Hi, this is the Taskmaster Fitness online fitness studio with me, Rachel Tasker, founder of the company. So, here in the online studio, we pick apart various topics of fitness, health, and well-being, and take a few moments to get practical. Illness and exercise. How do we get started into exercise once the illness is over or it's become manageable? And I guess first of all, I want to talk about different illnesses. So we might have, you might think immediately of colds and flu when you think of illnesses, or you might think of more chronic long-term conditions like rhinitis, which is a nasal congestion problem. You might have a cough that's related to asthma. Asthma is a chronic condition. Things that do affect that happen every day, that affect your daily life and have an impact in some way. So temporary condition generally is probably something that lasts definitely less than 6 months, maybe even less than 3 months, and is just a temporary thing, and you know it's not going to last. Like, I have hay fever, and up until very recently, I knew it was only ever going to affect me for 3 or 4 months of the year, and the rest of the time it wouldn't bother me. So it's temporary is something that we know is going to pass, and chronic is something more long term that isn't going to pass just like so. Colds and flu and the age old, if you exercise, you're likely to have less colds, or exercising will make you feel better. What that really means is that for most of the year, when it's not autumn, it's not September, October, November time, cold and flu time, if you train and you exercise, you're stimulating your immune system effectively, and you are less likely to get a cold, or you'll probably still get the cold, but it won't be half as bad as what it could have been, because your body is stronger and it's more resilient to germs. So either you won't get the cold as badly, or you won't even notice that you get it at all. However, exercising during a cold or flu is not going to make it better. Absolutely not. You will feel rubbish doing it, and it will inevitably make the cold or flu. And if you've got proper flu, probably exercise is the last thing on your mind. But even just with a cold, exercise will be the last thing. It will take longer to get over the cold. So it's not to say that we shouldn't exercise. It's that we should know that there are times when we shouldn't exercise. For most of the year, when we feel in good health, yes, exercise, gently push yourself. It will be doing you good. But just during the cold or the flu, sit up, put your feet up, drink plenty of fluids, warm or cold, and just let it pass. That said, with chronic conditions that are going to affect you for the rest of your life, you may be taking medication for them, like ulcerative colitis is a bowel disease that affects your bowel movements and can interrupt your life. It can affect how frequently you go to the toilet, without being too graphic, but I also probably shouldn't shy away from the topic. It can impact what you eat, how much you eat. It can be really uncomfortable. And like fibromyalgia is something that is well, I don't know if it's classed as chronic, but it's definitely something that is like a long-term disease that you have to manage, or chronic fatigue syndrome, or something like multiple sclerosis, which is a neurological condition. These are all things where exercise will benefit the disease, but you have to manage your symptoms along the way. So you have to exercise when it feels good. You have to monitor your intensity levels and make sure that it's not impacting on your day too much, but that in the long run it has a positive influence on the condition. This also can be noticed with things like osteoarthritis, especially of the knee, and it's probably something that I'll talk about again in another episode, but it's actually something that it seems counterintuitive, because you think if you've got a sore knee you should just stop using it, but actually the opposite happens. And not to insane levels, but if you exercise and you move it, it will actually get better. So whether it's a short-term cold or flu, or whether it's a long-term chronic condition that you're having to manage, how do we get back into exercise? Or how do we get back into exercise? How does it run alongside our lives now? And I've put on the slide there, the most important thing so often, especially coming back from cold or flu, is to start small. Or if you've been away from exercise for a long time, start small. The brain remembers what our last workout was, or it remembers the fastest or the strongest we have ever been. Muscles, however, don't remember. If we don't use them, they don't retain that information. They in fact lose ability if we don't use them. So with exercise, we have to start small and allow the muscles to build up again, and we will eventually get there. Maybe, if we're comparing ourselves to our 20-year-old self or our 15-year-old self, we might not get back, but certainly we can recoup 5 or 10 years worth of fitness, no problem at all. It's about monitoring ourselves. Revisit your last workout and reduce it by 50%, whether that's reducing the intensity, reducing the length of time, reducing the distance. Just reduce it. Start with half the capacity that you ended on and build it up gradually. And it would depend. If it was just a cold or a flu that had you out for 2 or 3 weeks, that gradual process might be 2 or 3 weeks to get back to where you were. If you've been away for more than 6 months, more than a year, then you might be looking at more like 2 or 3 months before you start to see yourself really gathering momentum and getting back. But the main point to remember is that fitness always comes back. Be patient, take your time. Not rushing into it also reduces the risk of injury. If we rush back into exercise too quickly, we can scupper ourselves by then becoming injured by something. My advice is just really, really start small. So going forward, I hope this video has been useful and that you've been able to take something away from it. If you have got a cold right now or flu right now, please just look after yourself. Take care. Lots of fluids, blah, blah, blah. And if you are back from a cold or you're coming back from a minor injury, just reduce your routine pre-illness by half and gradually build it up. Be kind to yourself. Know that you will get there. Reassure yourself you will get there, and just get back into the routine as soon as you can. You can grab the goal setting episode from the Taskmaster Fitness Studio, online fitness studio on YouTube. That will really help guide you in terms of setting short-term goals, so that you've got some structure that you can then follow and keep yourself adhering to. Or come and join me and the team in the HIIT and Chat classes, and we will help you with that easing back in process. We will help you with the motivation, with the structure, and just feel like you're not alone in that time of recovery. So I hope you enjoyed that today. If you have any questions, you have any specifics that you want to ask me about, then please do be in touch. Otherwise, take care of yourselves and hopefully be in next section of the video. Enjoy the movement section. Get ready. This is it. This is the movement part, the bit where we get a bit practical. So for this one, you don't need any equipment. You can be wearing whatever you like. You could even be in a dress. Wouldn't be a problem. So I want you to stand with your feet hip width apart. You're going to touch your opposite hip. You're going to touch basically, I'm touching my left hip with my right hand. So this takes me an unusually long amount of time. And you're going to do that 3 times. And then you're going to go for the outside of your thigh. And here, I just want you to move as much as you can. Every day can be different. Then we're going to go for your knee. You'll notice I'm tapping about 3 times on each part of the leg. And then we go calf, swing round, you loosen up as you go, you'll feel that. And the last one is outside of the ankle, reaching all the way down. If you can do it with your legs straight, perfect. If you need to bend your knees, that is also fine. Nothing is right or wrong. This is a mobilising exercise. We want to get the blood flowing and wake up what we call the posterior chain, but the back of you basically. So we repeat on the other side. I like a nice audible tap when I do it. You don't have to. You just want to make sure you're reaching round as far as you can in either direction. And like I said at the start, you might want to start off gentle and easy on yourself, especially if you've been sat for a long time or it's first thing in the morning. I'm now down to my calf. I'm just going to do once more, then I'll be on to my ankle. Then yeah, you might start off small, and then hopefully you'll notice by the end that you'll be reaching a lot further than you were before, and you'll feel more mobilised, more energetic as well. So that's it. Enjoy the exercise. You can do it anytime, anywhere. You can do it as a warm-up before exercise, not just on its own, but as part of a warm-up. And like I say, if you've been sat still for a long time, working or watching TV, whatever it may be, on a plane, then it's a really good one just to get you going again. But keep that in your memory bank. Take care.